organization on World Tuberculosis Day. I would like to let you know that we have simultaneous interpretation into 3 languages, Spanish, Portuguese, and English, and you can select the language of your choice, selecting the globe icon below.
Simultaneous translation in English, Spanish, and Portuguese. And at the bottom of the screen, you will see a globe. And if you click on the interpretation globe, you can select the language of your choice. Soy Pedro Abedillo.
I'm Pedro Abedillo. I'm advisor tuberculosis prevention, control, elimination of PAHO WHO. I will be your moderator. As you may know, every year at the end of March, we commemorate the World International Day of Tuberculosis to remember all the people that are being affected by this disease that is preventable and curable, and to raise awareness on this disease and to show and to reflect on the progress made so that we can increase our commitment in such a way that we can comply with all the goals that we have set for ourselves for tuberculosis. During this event, we know that there are major challenges in the region to respond to tuberculosis, especially in the TB pandemics after the COVID-19 pandemics, and therefore we need an urgent response to reverse the situation. However, we'll discuss how we have many opportunities for the region, so that the region is on track to put an end to tuberculosis. We know that we have sound commitments by the world leaders that can drive the response, and we'll have at our availability, our disposal, solutions that can make us closer to putting an end to tuberculosis. So that is the motto of this is, yes, we can end TB, commitment, investment, results, which is a calling for us to accelerate progress towards putting an end to tuberculosis so that 2025 is the year where we'll transform all the commitments that we have into action. And that is the goal that we have today for today's event. And to that end, we have the participation of special guests that will share their mission, important examples on how the progress is being made, commitment, investment, examples, and how the results are being obtained to put an end to tuberculosis. Today's agenda is headed by our director of PAHO WHO, Dr. Javas Barbosa. We'll continue with Monica Alonso, Unit Chief of HIV, Hepatitis, Tuberculosis, and Sexually Transmitted Infections of PAHO WHO in Washington. And then we'll have the participation of the authorities of 3 countries of the region. We'll have the participation of Dr. Victor Atala, Ministry of Health of the Dominican Republic. Also, Dr. Dario Barreira, who is the Director of the Department of HIV/AIDS, Tuberculosis, Viral Hepatitis, and STIs of the Secretariat of Health and Environmental Surveillance of the Ministry of Health of Brazil, and Dr. Eric Ricardo Peña Sanchez, Vice Minister of Public Health, Ministry of Health of Peru. So without further ado, I would like to thank all the audience, the participants that are here, for being with us today. And we would like to give the floor now to Dr. Jarvas Barbosa for the opening statement and the launch of the World Tuberculosis Day. Thank you, Pedro. Good morning, everyone. Excellent. Victor Atala, Minister of Health of the Dominican Republic. He will be joining us via video. Dr. Eric Ricardo Peña Sanchez, Vice Minister of Public Health of the Ministry of Health of Peru. Dr. Dario Barrera, Director of the Department of HIV/AIDS, Tuberculosis, Viral Hepatitis, STI of the Secretary of Health and Environmental Surveillance of the Ministry of Health of Brazil. Dear participants and colleagues of PAHO, I am pleased to welcome you to this event commemorating World Tuberculosis Day. This year's theme, Yes, We Can End TB, commitment, investment, results, is a call for hope, urgency, and responsibility, reaffirming the need to accelerate the implementation of interventions to end tuberculosis, the world's deadliest infectious disease. The TB situation in the region of the Americas requires our immediate attention. In 2023, an estimated 35,000 people lost their lives to tuberculosis, a 48% increase since 2019, with 1 in 3 deaths associated with HIV co-infection. Additionally, an estimated 342,000 people contracted tuberculosis in 2023, reflecting a rise over the same period. Countries in the region are making significant efforts to address this situation, as reflected in the growing number of people accessing diagnosis and treatment. In 2023, more than 265,000 people received treatment, a 9% increase from the previous year, representing the highest number in decades. However, complex challenges persist. Social determinants of health, such as poverty, malnutrition, stigma, discrimination, and inadequate access to healthcare remain significant barriers to successfully advancing towards ending TB. Vulnerable populations, including those living in low-income communities, incarcerated individuals, migrants, and indigenous populations, face higher risks due to living conditions and lack of access to healthcare services. Ensuring the right to health for all is essential for these people, including these are very important in our region. A clear example of the disproportionate impact on this population is the situation in prisons, where TB prevalence is up to 100 times higher than in general population. This highlights the urgent need to strengthen prison health strategies while enhancing cooperation between the justice system and the healthcare sector. Undoubtedly, eliminating tuberculosis requires a multisectoral response, including the participation of civil society and affected community. It is crucial to place people at the center of the response, promoting comprehensive policies, equitable access to healthcare, and commitment from all sectors.
Despite the many challenges, there are reasons for optimism. We have technologies and innovations that can reverse the trend and change the course of the epidemic. For example, digital radiology with artificial intelligence-assisted reading is a powerful technology that can increase early detection in the most vulnerable and hard-to-reach populations, as well in areas most affected by tuberculosis. Rapid molecular tests for early diagnosis for tuberculosis and drug-resistant tuberculosis, and shortened, fully oral treatments supported by telemedicine will improve treatment success and reduce the social and economic impact of the disease. PAHO is supporting countries in the use of these innovations. In several countries, such as Brazil, Dominican Republic, El Salvador, Guatemala, Paraguay, and Peru, among others, progress is being made in this direction. Furthermore, the Elimination Initiative, which aims to eliminate over 30 communicable diseases and associated conditions by 2030, including tuberculosis, promotes a comprehensive care model that optimizes resources, fosters synergies to minimize duplication, enhances the quality of care, and ensures better access to health services. With these tools, we will continue to work with governments, civil society, and partners to strengthen leadership, investment, innovation, and multi-sectoral collaboration, putting people at the center of our efforts. To align with this year's theme, I encourage you to first commit. A political commitment is necessary at all levels to implement available tools and innovations. Second, invest. Adequate funding is essential to incorporate these innovations and close the gaps in access to prevention, diagnosis, treatment, and care. And finally, deliver. Commitments must be transformed into concrete actions in collaboration with communities and stakeholders to expand the coverage of effective interventions. Commit now, invest now, deliver now. Together, we can end TB. Thank you.
Thank you. Thank you very much, Director Dr. Barbosa, for your inspiring words and for setting the tone on the way forward. Very clear message on the actions that need to be implemented. And the director has highlighted the concerning situation of increasing TB cases and deaths in the region and stressing the urgent need to accelerate our efforts to reverse this situation. Thank you so much, Dr. Barbosa, for being here with us. And now our next speaker is Dr. Monica Alonso. She is the Unit Chief for HIV, STIs, viral hepatitis, and tuberculosis at PAHO in Washington, D.C. And Dr. Alonso will present the progress towards TB elimination in the Americas. Please, Dr. Alonso, the floor is yours.
Thank you, Pedro, very much. It's an honor to be here. I am currently trying to share my screen and the presentation. I hope everybody can see it, right?
Yeah.
So in my presentation, we will review a little bit more the situation of TB, and we will provide the segue to the priorities for elimination of TB in the region of the Americas. I will move on to Spanish. Aquí tenemos los indicadores.
Here we can find the indicators that you know very well on the incidence rate and the amount of deaths by TB. And as Dr. Barbosa mentioned, we see an increase, a constant increase of the incidence rate with a 20% increase, more than 2015, the baseline for the strategy to put an end to tuberculosis, and a 6% increase compared to the previous year, 2022 to 2023. Likewise, the amount of deaths increased significantly from 44% from 2015. And we can see that we all know that how the region of the Americas has been one of the hardest hit region by COVID. There was a major interruption of the TB services together with a high transmission rate has meant a significant increase of the deaths by TB. A similar image is the amount of reported cases in our region observed in the orange line. We have seen 264 people that have reported to have contracted TB, the highest figure in the last decades. And we know that there is an approximate gap of 76,000 people with TB that were undiagnosed. We know who they are. These are people, as Dr. Barbosa mentioned, persons in prison, deprived of their liberty, contacts of tuberculosis. A quarter of this would be people living with HIV, and of course, people who live in hotspots for TB and other vulnerable populations. To bridge this gap, we have key tools like rapid molecular tests for the initial diagnosis of TB in the Americas. However, while our goal is 100% of diagnosis using these rapid molecular tests, Nevertheless, by 2023, around 47% of the TB diagnoses were made with this test as an initial diagnosis. Therefore, it's important to expand the rapid molecular test to 100% for diagnosis and also to monitor the late diagnosis. Together with the expansion of the rapid molecular test, this late diagnosis should be reduced, as well as the lagging time until diagnosis. We do have information on the amount of people deprived of their liberty in prisons around the world in our region. And it's worth mentioning the rapid increase of these people from 2000 in the region of the Americas. Here we can see on the left the graph without taking into account the US, which has seen an increase over 161% in the number of people deprived of their liberty in our region. And we see on the right how this is associated with an increase in the region of the Americas. Is the only region where there is an increase in the incidence rate of TB in prisons, as we can see in the graph, the red line, with this increase of the incidence. And in comparison with other regions of the world, they all show incidence rates in a downward trend. So people deprived of their liberty account for 9% of the cases of TB, but the TB impact on the prisons is higher. It is estimated that almost 30%, almost 27% of the TB cases come up from cases that are present in people are deprived of their liberty. This may vary from country to country, but approximately at the regional level, this is the estimated figure so that you can understand how important it is to address TB in this context. And then we have models according to this article, Mabut's article, that shows how the combination of different interventions like massive screenings in prisons or admission and discharge, screening with the preventive treatment of tuberculosis has a great impact on the decrease of TB incidence. The combination of these interventions can reduce the TB incidence in prisons by almost 80%, and in our communities, it can be reduced, the incidence that is, by almost 40%. We do have examples of Doctors Alarcon and colleagues in Peru, how active search tools are finding a major amount of people in prisons, and information as to almost how half of the people diagnosed with tuberculosis with these new tools like CADRX, almost half of these people were people in under clinical stance, so that they were asymptomatic. So these innovations allow for finding new people and also putting these people under treatment with better results for the health of people themselves and lower transmission rates in this context, in prisons that is, and communities as well. Here on the left, we can see a graph showing the coverage of screening in different subpopulations. There is a recommendation, a strong recommendation of screening, of TB screening in people with HIV in contacts and prisons. However, we see that there is insufficient coverage for screening of these populations. We see 28% in prisons, 18% in prisons, and we cannot see here in this graph, but there are many countries that are not reporting this information. We do have problems like not enough financing for these new technologies and high reliance on donations, as we can see on donors. And we can see on the right from 2024 to 2025, we moved from 9 countries to 15 countries. And there was also an increase in these pieces of equipment with these AI-assisted machines. However, there are still major gaps to be bridged, and there are several countries that are spearheading, like Paraguay, Peru, and Colombia, with excellent results to find more cases of TB. These screenings with these technologies are not only helpful for putting people under treatment, but also it's an opportunity to make a comprehensive preventive treatment, especially, as we said before, in people in prisons and contacts and people living with HIV. I wanted to mention some of the aspects of the TB HIV co-infection. Besides the screening and the RX and the rapid molecular tests like GeneXpert, we also have new tools that may help those cases of advanced disease by HIV. On the left, we can see the results of 4 countries, Guyana, Brazil, Paraguay, Trinidad and Tobago, where there was a screening in several hospitals with the TB-LAM PCR test, where you can see the test strip, where we can see a high level of the percentage came out positive. So that is to say, they presented TB using this diagnosis technique. On the right, we can see how the diagnosis performance with different tests, with rapid molecular tests, how they complement each other. LAM helps have a higher diagnosis performance with people living with HIV with CD4 lower count, especially better in people with lower levels. And this can be conducted in patients in just a couple of minutes. So the simultaneous use of these tests can improve the diagnosis performance. I would like to stress, and going back to the graph on the top left, we have the data divided because of new HIV diagnosis at advanced stage of immunodepression, and people who had been HIV diagnosed under retroviral treatment, but who had abandoned the treatment and that would go back with an advanced HIV stage. In the orange, the resumes, the restarts. And we can see a high level of TB-LAM. And this makes us think how these people could have started with the healthcare services using the TPT tools. And here we can see at the regional level of the Americas how newly diagnosed people with HIV, with the yellow bars, we can see a low reporting percentage of TPT start with the green bars. As regards TB treatment and DR TB treatment, we can see on the left the evolution of the treatment success. In green, the treatment success of TB sensitive, and in blue, the success of treatment of DRTB with a slightly upward trend. We know that countries are implemented BPALM and BPAL. We have the 2025 map, which shows that almost every country have incorporated this new line of medications which are highly efficient. So one can only hope that we will see an increase for 2023 and 2024 once the data is presented, an increase in the success that is of DRTB treatment with these new oral shortened schemes. But it's striking, though, that we have not improved in the success, in the treatment success of sensitive TB. In fact, there has been no improvement compared to the previous year. So this is a calling so that we can make a higher effort and provide better support for people to improve adherence with comprehensive services in the primary care level, with higher community support from community health workers and payers and community leaders, and also with tools like telemedicine, as well as all the interventions that will be addressed later on as regards social protection. And as regards social protection, we can see the economic burden faced by people with TB. On the left, we can see the percentage of household affected by catastrophic costs in different countries that have been involved in the survey. And we can see that between 13 and 52% of households became poorer after the TB incident. This does not mean that they were more impoverished, but these are households that faced an income reduction of over 20% compared to the previous stage before TB. But it's not just over 20%, but between 3 and 20% of these households lost more than half of their annual income because of TB. And one of the examples, and I believe it will be addressed later on, how unemployment increased among people after the TB incident between 2 to 35 times. We can see how in the informal employment and formal employment in green and blue, respectively, we can see a movement towards the pink group unemployment. So from 23 before TB to 44 level of unemployment after TB. And then, in short, what are the pillars and priorities for TB that we have reviewed during this presentation? The active search with these new tools, facing vulnerable population as hotspots, using also the information to better address our actions in a more effective manner. This active search and these broad screenings in different places are a major opportunity for implementing TPT and the contact search, as well as the rapid implementation of shortened treatment in people and focused on people with community support and the social protection tools, which are very important to break the poverty cycle where all these people are embedded. And we will see also an example. One of the speakers will address this, the multisectoral approach, the involvement of civil society and communities across all the TB response. So looking, searching, curing, preventing for everyone. Thank you very much.
Thank you very much, Monica, for your presentation. We have seen more in detail the response in the regions and the challenges that Dr. Barbosa also mentioned, but we also seen the opportunities and the advancements and the priorities that we are setting to address this concerning situation and how to move towards the end of TB. The countries of the region are moving forwards in this direction, and especially right now we are going to learn some of the examples that we are seeing in the regions, experiences, interventions. These are highlighted experiences about commitment, about investment to put an end to TB and the results obtained. So next, Dr. Victor Atala, the Ministry of Health of Dominican Republic, is going to share a video with us about the commitment that they assume in their country to see the advancements that they are making in the last few years, especially the advancements that they have in the preparation on the multisectorial commitment framework for the response to TB in the country. So the floor is yours. Good morning, everybody, and thank you very much for this invitation. This is a great opportunity to be a part in this important channel about the commitment, investment, and achievements to put an end to tuberculosis, TB. I'm honored to be sharing with you the advancements and the success that we in the Dominican Republic to be an infectious disease, which is still the main cause of death in the world, just because of one single infectious agent. Being aware of these challenges and with the highest level meeting of the UN in 2023, we increased the efforts in our country. In this sense, the Ministry of Health, through the National Program for TB that leads the strategic for this disease, we made great achievements in which we greatly reduced the gap in the detection of cases and increased according to the estimations of the WHO. In the same way, mortality is showing a downward trend with a reduce of death attributed to the TB, reducing by 25% the incident from 2025 and 35% of death. Likewise, from our commitment towards our goals in the third high-level meeting of the UN about non-transmissible disease in 2023, we highlighted the following advancements by 2024. Coverage for treatment for TB, we reached 93% in 2024, exceeding our goal of 90%. The coverage in rapid tests, we moved from 8% in 2018 with the goal to achieve 100% in 2027. Special healthcare packages, we reached 95% of coverage. Funding for essential services, we covered 95% to achieve these goals. Our country is carrying out a series of action within which we found first, sustainable funding from the international funding. We increased the state funding in the fight against TB with an assigned budget of $6 million and almost $7 million with a budget model towards results in which we have different different government institutions. Number two, access to rapid molecular tests to increase the coverage. We bought 33 pieces of equipment distributed throughout the country. Number three, short treatment and more efficient. For child TB, for drug resistant, we reduced the time of treatment for 6 to 3 months, and for adults for 18 to 6 months. Number four, the use of mobile equipment using AI for early detection, especially in penitentiary centers. Number five, social inclusion of patients with TB. We implemented policies to mitigate the financial impact in the households which are affected, including the access to social process such as Superate, that fosters dietary supplements, services, and re-education of households. Number six, intersectional efforts. We coordinated with the National Social Security Office to cover TB in our national healthcare program, guaranteeing the greater coverage for patients. One of the main commitments that we assume in our country was the implementation of the Accountability Multisectoral Program for TB. This is a strategy that gathers 17 key sectors, including finance, social policies, justice, education, and social society. By means of intersectoral programs, we incorporated programs against TB in their everyday routine with budgets for their implementation. Our government is strongly committed to eliminate TB. Our growing investment, the broadening of the coverage, and the implementation of intersectoral strategies take us forward to fulfill the world commitment to end TB by 2030. Let's keep working together. We understand that your commitment and determination is crucial to end TB and to guarantee a better quality of life for our population. Thank you very much.
Muchísimas gracias al doctor Atala por sus palabras.
Thank you very much, Dr. Atala, for your words. Dominican Republic, it's a very good example of sustainability, expansion, and national investment in response to TB, with the support of the World Bank and the multisectoral commitment which is required to put an end to TB. We know that TB is a disease strongly related to economic inequalities related to poverty. Therefore, we need this commitment and this intervention of all sectors to face these social and economic determinants that have such a great impact in the society and on the population. So we expect that the experience of the Dominican Republic, it's an example for the region. So congratulations and thank you very much. So we are more than 550 people here today. So thank you very much for your participation. And we are moving on with our agenda. Now I'm pleased to welcome Dr. Barreira, which is the Director of the Department of HIV, AIDS, Tuberculosis, Viral Hepatitis, and STIs of the Secretariat of Health Environmental Surveillance of the Ministry of Health of Brazil. He's going to share the investments and their commitment and the impact that these programs are having towards eliminating TB with the people which are in a more vulnerable situation. So Dr. Braulio Barreira, thank you very much for your participation today, and the floor is yours.
Bom dia. Good morning to everyone. Gracias, Pedro, por la invitación, por todos los colegas de
Thank you, Pedro, for the invitation, to all my colleagues of the PAHO from the Dominican Republic, for Peru, for El Salvador, for being a part of such an important webinar. I'm going to talk in Portuguese in order to guarantee my proper communication of my message during 10 minutes.
Okay, let's begin.
Bom, como todos sabem,
As you all know, Brazil is a country with a very high load of TB and also an extremely unequal country. We compared to the Americas incidents, and we have approximately 84,000 new cases of tuberculosis last year. And for the first time in history, we had more than 6,000 deaths in 2023. It is very important to say that TB, as you know, is focused in the vulnerable population, especially those in prisons, homeless people, native populations, also immigrant populations. 25% of the TB cases in the country involve these populations I just mentioned. As a consequence of the social determinants of this disease, we have continued interruption of treatment, which reach approximately 15% of those treated for tuberculosis in Brazil.
eu não vou entrar em muitos detalhes em função do
I
tempo.
can't give you a lot of details because time is short, but you know that even in cases in which the state gives you vaccines or drugs, prophylactic treatment, and all sorts of attention, TB still leads to continued poverty. You can see in the upper plot on the left, you see that the blue portion in Brazil that gets direct medical attention are the punctures in blue, but the indirect costs and income loss are more than 90% of losses resulting from tuberculosis in the country. We heard from Dr. Monica in the lower plot that it is important that after the onset of TB, there is an important migration of populations in all conditions, people who are self-employed or retired, and they all migrate to unemployed. You see that after the detection, you see that we have more than half, or we have almost half of this population moving towards unemployment conditions. My main message is on the need to integrate different sectors, ensuring the investment and the commitment in facing TB, but especially facing and resolving the social determinants. In Brazil, we have two large systems in our social security. Number one, the the unified health system, and also the unified social assistance system. Health is health that's ensured by the Brazilian Constitution, and the federal framework ensures that at least 12% of all resources in the countries are invested in health, and this always changes according to the GDP in the previous year. So if the GDP grows, then the investment in health will be applied. Now, at the state level, the required investment is 15%. Health is a universal right, but also social assistance, no matter if the citizen pays social security or not. And this financing is shared between the public budget and contributions paid by taxpayers, both private and companies. I want to give you two very important examples of this investment in health, direct or indirect, which is the so-called Unified Registered, CAD Unico, which was created in 2001. In this register, we have all the low-income families to ensure their access to social programs. The Unified Register is made by in the entire social assistance network in the country, and until last year we had 73 million people included in the unified register, and this includes foreigners, immigrants, all of those with income below $43 a month. This register is compared to many other information systems, especially with the health information system, allowing us to provide social assistance through the health system for those who are living in poverty and are affected by the socially determining diseases such as TB. The family grant, so to speak, was created in 2003 and included more than 90 million people. Nowadays, it reaches approximately 73 million people. And an important aspect of this income transfer system is linked with the children attending school and also with the vaccination status and also additional literacy programs and professional qualification programs. My time is almost up, so I'll try to speed up. I wanted to say, and you can see in the plot on the right, that of those who get some kind of income transfer, you see the native population in blue, in green you see immigrants, in orange the homeless, and in dark blue those in imprisoned population. We see, for example, that this variable of those populations are now also recorded as beneficiaries of an income transfer program, and approximately 9% of the detected cases of TB last year were beneficiaries of these programs. We expect these numbers to be higher because we understand there's some underreporting happening. Nowadays in Brazil, we have a cohort of 100 million Brazilians who were registered in the Unified Register. Next. Please move on to the next slides. I don't mean to read all that you see on these slides, but these are all evidences in the literature showing the effect of the income transfer program of the family grant. In Nature magazine, we had an article showing the reduced mortality in incidence. That's what you can see in the lower left part of those receiving the Bolsa Familia. And many other studies have shown the reduction in treatment interruption, increased success rates in treatment. So this income transfer program has a direct effect in improving operational indicators such as treatment interruption as well as treatment outcomes with reduced mortality, reduced reincidence cases, and now we're going to have the two last slides. And I wanted to say that this presentation can be downloaded by you if you are interested in the details. Now consider the direct or indirect effects of the family grant program. You see that the indirect effects of this program in housing, education, food safety, food security, and many other components are more important than the direct effect related to reducing costs in treatment or even the direct support to TB patients. Last slide. This will be brief, but this shows a historical series of all the social protection actions we deployed for TB since 2017 with the plan Brazil without TB. We established many partnerships with the Ministry of Social Development in these years, and last year we launched the program Healthy Brazil with the PAHO and the WHO to eliminate TB. In Brazil, we chose 11 diseases and 5 other diseases transmitted from mother to child. And this was being done by the creation of an interministry committee to eliminate TB and other diseases that are socially determined. It is now the year to implement this policy and this disease elimination program, and we hope that by 2030 we're going to be able to deliver and eliminate many of these diseases as it happened last year with the presence of Dr. Barbosa in Brazil and also the WHO director in Brazil, eliminating lymphatic filariasis, and we hope that TB will be eliminated by 2030. My last slide emphasizes the sensibility of the social assistance and raising awareness among these populations and the recommendation in the social assistance to refer vulnerable TB patients to the proper services. We have also worked with Congress and discussed specific financing. States have also developed specific social benefit strategies, such as the state Rio de Janeiro, where they have special cards for transportation and for other social benefits. Sorry, I'm using than the time that was allocated to me, but 3 key messages for this presentations are that social vulnerability needs to be measured, and this is an effort being put in by the programs and the scientific community and civil society to properly measure the current status and the progress towards reducing social vulnerability. Second, expanding coverage at the same time as we strengthen health and social protection systems. These two things can't be treated separately. It is fundamental to treat social assistance and the health system together. And finally, specific TB strategies that need to be improved along with social protection actions. Thank you very much for your attention. I hope I have contributed some to this debate towards eliminating TB. Thank you very much.
Thank you very much, Dr. Barreira, for the description of your social programs such as Bolsa Brasil, which are fundamental when fighting TB, facing social determinants to reduce poverty, all inequalities, and to achieving these results for TB. All in all, thank you, Dr. Barreira, how the program Bolsa Familia has contributed not only your country but throughout the world, because it has a direct and indirect impact to improve the results of the treatment, incidence, and mortality in TB, and especially in the more vulnerable populations. I think that the path that Brazil is going through this
para la erradicación
multisectoral
integral, no solo de la tuberculosis,
initiative,
sino
not
también de
only
las
to
asociaciones
eliminate
contaminadas.
TB, but
Es un
other
ejemplo, como
social
decía, muy
influence
emblemático y un
diseases,
ejemplo
is an
incluso
emblematic
para
example
las
and an
regiones más cercanas.
inspiration
Felicitaciones,
for all the
doctor
region.
Traurio.
Congratulations, Dr. Barreira. Muito obrigado for your
Seguimos
participation.
con la agenda.
Moving
Comentarles que
on
casi
with
600
our
conectados en este momento.
agenda,
Muchas
our
gracias
schedule,
por
we
su
are almost
participación.
600
Y a
people
continuación
participating here
voy a
today.
dar la bienvenida
And next, I would like to
doctor
welcome
Peña Sánchez,
Dr.
viceministro
Peña
de Salud
Sanchez,
Pública del
which is
Perú,
the
que va a
Vice
compartir con nosotros
Minister
la
of Health
experiencia del
in
país
Peru, who's going to
en la
share
implementación y el
Peru's
avance que están
experience in
realizando
the
en la atención
implementation and
de
the
las
advancements
recomendaciones, las
that they are
innovaciones que
having
tenemos
towards
para
the
la tuberculosis y en
recommendations that we
concreto
have
sobre el tema de
for
tuberculosis
TB, and more
resistente y la
specifically
implementación de los esquemas
for
acortados
drug-resistant
para
TB,
tuberculosis, ¿no? Como ejemplo de
and
resultados
the examples
logrados
as
en
an
el país.
example
Doctor
of the
Peña,
results achieved
gracias
in the country.
nuevamente
So,
por su
Dr. Peña, thank
participación
you
en el
very
día
much
de
again
hoy
for your
y por favor
participation
adelante,
today.
tiene la palabra.
Please, you have the
Muchas
floor.
gracias, doctor Pedro Abedillo.
Thank you,
Saludo especial a doctor
Dr. Pedro.
Barbosa,
A
a todos los
special greetings
representantes de
to
la
Dr.
Organización
Barbosa
Panamericana de
and all the
Salud, los
representatives
representantes de los
of the
países
PAHO and all the
panelistas y también
countries and all speakers that we have
todos los
today,
presentes. Para nosotros
all
es
participants
inmenso
that we
placer
are having. For us,
poder
it's a great
presentarnos para
pleasure
dar cuenta de los avances que
to be
estamos
here to tell you
trabajando desde el
about
Ministerio de
our
Salud del Perú
advancements. We are
en el marco
working
de la
in
lucha
our
contra,
Ministry
contra la
of Health,
tuberculosis.
fighting
Muy
for
bien,
TB.
quiero que si me confirman que se está viendo la presentación, por
Can you
favor.
confirm that you are seeing my screen? Yes,
Sí,
yes, we
gracias.
are
Muy bien,
seeing it.
primero, para poder hacer una descripción de lo
First of
que
all, I will
implica
make
la
a brief
implementación de los esquemas
description
orales
about the
cortados
implementation
para la
of the
tuberculosis
scheme
multiresistente en nuestro país. Quisiera
for
hacer
drug-resistant
una breve
TB.
descripción del comportamiento
I
y
would like to make
tendencia
a
en los
brief
últimos
description of the
años en
trends
nuestro país
in the last
en
few
la
years in
tuberculosis.
our country.
Ustedes pueden apreciar la línea
As you can
azul o
see
celeste
here, the blue line or the
de
light blue,
tuberculosis o formas resistentes de la enfermedad
we
con
have the
tendencia a
multi-drug
tendencia incremental
resistance
importante.
TB
Sin embargo, hay
has
que tener en
an
consideración
increasing
que
trend, which
la
is very
capacidad
important.
diagnóstica
Also bear
ha
in mind
mejorado
that our capacity
sensiblemente.
of
La
diagnosis has
implementación de pruebas
greatly
moleculares que
increased,
permiten
and
no
the
solamente
use
acortar
of molecular tests,
el tiempo para poder identificar
the time that we
o
can
las mutaciones que
identify
generan resistencia
the,
por el patógeno
to the mutations
ha
that
constituido una revolución en la
make
forma
this
diagnóstica, lo que nos ha permitido tener
the
una mayor
resistant
capacidad de
variations
identificar
make
estas
us
formas
a
implicadas de
gave a
la
greater
resistencia.
capability
Y esto definitivamente
for
tiene una
detections.
gran
So
ventaja toda vez de
this
que al
means
detectarlo
a
de manera
great
oportuna
advantages, because
y
when we have
identificar
an
la
early
resistencia de
detection or a
estos
timely
vasos,
detection,
inmediatamente se procede al tratamiento
so we
correspondiente para
move
poder cortar la cadena de transmisión.
straightforward to a
En
treatment in
cifras,
order to
hasta el año pasado,
stop transmission.
tenemos
Until last year,
rasgos, una población que
we have
supera los
more or
34
less
millones de
a
habitantes en toda la
population
extensión
of
del
more
país.
than 34 million
Hasta el
inhabitants in
2024
our country.
se
Until
tuvieron
2024,
51.950 casos de tuberculosis y
we
estos
had
datos
30,
dan
almost
cuenta de la presencia, de
33,000
la cuantificación de los casos
cases of
nuevos, las
TB.
recaídas, con
We have
complicación
new
bacteriológica,
cases, we have
la proporción de coinfecciones TB-VIH,
we have
tuberculosis y
co-infections
diabetes
with
mellitus, y el
TVP
avance
together
de
with
la proporción
diabetes
de terapia preventiva
and the
de
advancement
tuberculosis.
of preventive
Además, las
treatments.
cifras absolutas de casos de
Moreover,
tuberculosis multidroga
the
resistente,
absolute
resistente
numbers
a la
of
artemisina y la XDR.
TB,
Y también
MDR,
tenemos una
we have
descripción
also the cases of
geográfica
TDBR,
de
and we
nuestro
also
país.
have a
Ustedes pueden
geographic
apreciar
distribution in our country. As you
fundamentalmente
can
la
see,
epidemia se concentra
mainly
en
the
Lima,
epidemic is
más del
focused on
54% de
Lima.
casos
More
está
than
ubicado en esta
54%
área
of the
geográfica, en
cases
la
is
capital,
located
con
in
una
this,
mayor densidad
in the
poblacional y
capital
obviamente
city,
las
which is,
características
of
de los
course,
determinantes
more
sociales que incrementan el riesgo de padecer estas formas,
highly populated,
no solamente de la tuberculosis, sino de
not
formas
only for TB, but
multiresistentes o resistentes.
for
Ustedes pueden
TB,
ver
MDR.
el 73%
So
de
you can see
casos
that
de formas
73%
resistentes de la enfermedad
of
están
the cases
concentradas en
of
la
TB,
capital
MDR is
y el 90% de
concentrated
casos
on
de
the capital
tuberculosis
city,
o
and the
tuberculosis XDR.
90% of TB,
En función de
XDR,
esta
it's
evaluación
also there.
epidemiológica en donde se puede ver el
Based on
mapa
this
de la
epidemiologic assessment, as you can see on the map on the right, we see, as you can see, the places where there is more incidence. We have in the Amazonian region, which is more concentrated, but we also identified on the shore and on the heights. So we are willing to expand our diagnostic for TB and TB-MDR. We have 14 labs to increase the capacity, from 14 to 29 in 2024, with the capacity to perform the molecular diagnosis even for the more resistant varieties. The idea for this year is to guarantee the labs with 100 coverage, but also to identify resistance for first and second line in all the region. We are strengthening national labs and hospital and specialized institute, especially in the penitentiary system, as mentioned, constitute a key population with the potential to transmit with more resistant varieties in the general population.
We have the coverage here of an upward trend in the last couple of years, especially to have these elements that would enable us for a timely diagnosis, and also the resistant variants to act in accordance. Moreover, we are fully convinced that the first level of care is a space which is the entry door for healthcare services, and also being close to the community enables the implementation of teams that would allow us for timely diagnosis is fundamental to fight against this disease. The ministry, as a main axis of the political commitment, tries to strengthen the care level with a combination of teams of and equipment of RX, AI for diagnosis, and molecular biology equipment for the first primary care level, for swift implementation in the primary level, and also hemoglobin analyzers, H1C analyzers. As you were able to see in the previous slide, the ratio of TB and diabetes is a major comorbidity. The expansion, as we said before, of the molecular diagnosis has a higher concentration in the territory with higher case incidence for resistant variants and not resistant variants. RX seeks to detect the key populations. There has been a major scientific contribution by a researchers team, which are being led by Dr. Alarcon, who is responsible of the TB treatment in our country. In accordance with this evidence, all the axes are being aligned for intervention policies, because the administration of the ministry is concerned about responding with evidence-based answers. So the oral shortened schemes for MDR-TB, we have the incorporation of new technologies in the positive list. We want to assure the sustainability of interventions, and to that end, in our office, we have called all of those responsible of including the positive list of the latest technologies through the National Authority of Inputs and Technology. We have included complementary lists and pertomanid technologies, and also we have all the rest of the drugs like isoniazid and rifapimicin for these treatments so that they are sustainable, so that we can reach the population in need. This is a timeline where we have achieved major milestones. The impact of these shortened oral schemes are spectacular. We are moving from a therapy that made patients receive 150 injections in over 8,400 tablets in 18 months to 786, tablets over the course of 6 months orally. Of course, this is an improvement for treatment adherence with a major impact in the efficacy of the treatment. We are moving ahead with the implementation of shortened oral treatments. As you can see, the amount of cases that have adhered to these schemes for MDR-TB, and as you can tell, this has been implemented across the country, except in some regions that because of the absence of cases of MDR-TB cases that might be susceptible to enter these schemes, there is coverage across the territory. And as I was saying before, this has a major impact in treatment adherence and in the success of the therapy. As you can see here in both graphs, the behavior of the trends across the years, along the years, but as an average of the behavior of the success of the treatment success has reduced to 23% abandonment rate. With an 18-month scheme, it was reduced to 7.5% with a shortened scheme. And then the healing rate, the curation rate went from 60% to 90% with the shortened oral schemes. So we need to move forward to reach patients that are susceptible to MDR-TB. With the help of the healthcare team, with the government, who have considered one of the main fighting items to reach these populations. And I remember with joy having participated in the campaign of the WHO with the first treatment that received the shortened oral treatment. This was quite moving, and we can see the image of the patient that has been cured and, of course, reinserting again into society, to his job, and being economically active. And as we have seen in the previous presentations, this impact is key for families' well-being and household well-being and the progress of population as a whole. So in terms of budget, we have increased the TB components between 2018 and 2025. As you can see, the upward trend that exceeds 575 million soles in financing. We are well aware that this requires a higher investment. We are insisting on the Ministry of Economy to accelerate several components of interventions. That is to say, preventive intervention, census, service, and medication administration in these schemes, which consist in a theoretical improvement. And with this, we will most probably achieve success. So I would like to thank everyone for their work and the evidence generated in our country to help all the PAHO countries achieve this goal in coordination to put an end to this disease in our countries. Thank you very much. Mr. Vice Minister Ricardo Peña, thank you for your words and congratulations for the country's determination to move forward in an accelerated manner with all the strategies and recommendations to put an end to TB, focusing, as you said, is strengthening the primary care level of care and how this translates into an increase of financing, as you have stated. Peru is a pioneer in the region of the implementation of the innovations and technologies to improve active search, as you showed with the digital RX and AI, and also the response in prisons, as we have seen the implementation of oral shortened schemes for MDR TB treatment. With this progress and the speed of the progress, hopefully we'll make great strides and achieve wonderful results. And we hope that all of these advancements accomplished by Peru as a country of high MDR TB resistant country, MDR TB countries, this can be an inspiration for all the other countries in the region. So Dr. Peña, congratulations and thank you very much. And as I was saying before, we'll continue with Peru. We'll see this video on the experience of the implementation of the shortened schemes, including the testimony of healthcare staff and the national program participants and people with DRTB. And as I said before, with testimonies. So let's go ahead with the video then. I was coughing a lot and I couldn't breathe. I was choking and I couldn't talk. When patients arrive, they usually had a cough for 15 days or more, or some other discomfort, such as sweating or fever. They usually arrive with these ailments. The doctor examines them and sputum test is done to find out if this patient is positive for TB. Tuberculosis is a contagious disease that mainly affects vulnerable populations. Lima has the highest percentage of affected people in Peru. Tuberculosis can be cured, however, sometimes the treatment is not effective due to the resistance that the bacteria develop to the drug test. In this scenario, it is necessary to try another regimes. When I got the injection, my whole body hurt. I couldn't sleep. We had more than 33,000 cases of tuberculosis in 2023. Of those, about 3,100 are drug-resistant TB, and of those 3,100, about 22,050 cases are multi-drug-resistant TB and rifampicin-resistant TB. This new regime, B-Palm and B-Palm, is a much more acceptable one. It's more beneficial in the sense that the patient no longer needs 18 months of treatment, but only 6 months, all completely oral. We have more than 500 patients already in treatment with short oral regimes. Through the tuberculosis strategy, since last year, we've been providing information to health workers about the new oral regime with explanations about the new drugs that were going to be used. This has posed the challenge of restudying the new drugs, their adverse effects and their use, not only by medical staff, but also by the nurses and technical staff who help us in order to properly guide the patients. After I was diagnosed, I felt bad because They told me it would be a year and a half with injectables. It's super exhausting, difficult. Compared to that, this new treatment, the BPALM regime, is easier, it's shorter, and it has better results. Before, there were a lot of medicines, an average of 17 pills plus an injectable. I had many patients who dropped out of treatment. Patients feel more comfortable now and they are grateful because the new scheme is shorter, 6 months in the case of BPALM, and there is no injectable.
We have begun to expand molecular diagnosis, which is a WHO and PAHO guideline to strengthen health services at the first level of care, to bring specialization to the first level of care. I would remind patients of all the efforts the country is making to introduce new drugs and the best treatment regimens to shorten times, to improve the oral routes of administration, and provide a much shorter, much easier preventive therapy for TB. By improving diagnostic through molecular biology and digital radiology, the country is trying to provide the best treatment to patients. And what we ask of the patient is that they adhere to treatments. At the health center, they took good care of me. We are all like a family, the doctor, the nurse, they took good care of me. Even on Sunday, I took the pills without missing a day. Don't let this disease beat you. You can fight. And before, we are like before, healthy. Following PAHO and WHO recommendations, in October 2023, Peru initiated a new treatment for TB-MDR with a short oral regimes that are easier for the patient. PAHO and WHO are accompanying these efforts by strengthening technical capacities, facilitating the procurement of medicines through PAHO Strategic Fund, and helping to update public policies on this subject. So, PAHO and WHO congratulate Peru's effort to end TB. And we encourage the authorities, the technical teams, the health workers, communities, and families to continue working together towards a common goal: the health and well-being for all.
Agradecer de nuevo al Ministerio de Salud
Thank
de
you
Perú,
again
a la
very
doctora
much to the Ministry of Health of Peru
Alarcón
and
y
Dr.
todo el
Alarcón
personal
and all the
trabaja
team and
en
all
Perú
the
para lograr estos
healthcare
resultados,
workers
a la
in
oficina
Peru
de
to
PES en
achieve
Perú, que hemos
these
hablado de la
results.
Birmingham también, y sobre
The
todo
PAHO
a
office in
Benito
Peru,
Angeli por la
and especially to
colaboración
Benito
para
Angeli
realizar
for the
estos vídeos. Y
collaborations
bueno,
to
felicitarles de
make
nuevo
these videos. So congratulations once again for your
más
advancements.
acortados, pero también
So we
por
see that
a ese
these short
paquete más integral
schemes
de atención
together with the
centrada en la
integral
persona que aborde de forma
care
integral las comorbilidades y
oriented
los
towards the
cuidados que son muy
person
importantes, pero
to
también
provide all the
incluyendo esos
necessities
como
and
tienen
all
en
the
Perú de la canasta de
programs as
alimentos
they have
o
in
más
Peru
amplios, como
for the
podríamos
canasta de
hablar
alimentos,
en Brasil, el apoyo de
and
la sociedad
also
civil de la sanidad
the,
y el uso de herramientas de
the
telemedicina
support in
que pueden
Brazil
favorecer
together with the
la dispensación,
medical
la toma de
tools
tratamiento, el seguimiento.
that could
Son todo ello
improve the
intervenciones
follow-up, the
que
treatments.
van a
These are all
permitir cambiar los
interventions
resultados,
that
que nos
will
van a
allow to
permitir
change the
que más
results, that
personas
will
en
allow
tratamiento
us
puedan
for
finalizar
more
bien su
people
vida
that
y no
in
tener
treatment
esos
could
costos
finish
catastróficos que hemos vivido
successfully
Solo
and
recordarles
not
que
to
el
have
vídeo que
an,
hemos
a
visto
terrible
está en la
ending.
página web de la OPS,
I
en la
remind
web de la
you that this
OPS,
video that
y
we
vamos
saw,
también a
it's
compartir
on
los
our
materiales para
website,
evaluación
and we are
posterior
going to
y los
share also
materiales
the
que
recording
se han
of these
acabado por
events and
enviar
all
o por
the
enviar. Con
materials that
esto,
we saw today.
colegas, estamos llegando al
So
final
we
del
are
evento.
reaching the
Nos
end
disponemos
of
a
our
concluir con
event.
más casi
We are finishing
630
with
participantes
almost
conectados, además de todos los
630
colegas
people
panelistas que siguen con nosotros.
connected,
Gracias, muchas gracias
plus
por
all the
estar
speakers.
el
Thank
día
you very
de
much
hoy.
for
Bueno, en
being
resumen,
here
hemos
today.
visto que
In summary, we see that the situation in the region is really concerning. It requires urgent attention, immediate attention. We have many challenges, but also we are optimistic. We are positive because we have tools, we have innovation that will strengthen our biomedical response through for the active search, the diagnostic to address vulnerable populations that are being left behind. But also we have preventive treatments, which is very important and efficient to cut the transmission chain, and the packets of treatment oriented towards the persons. In biomedicine, we are expecting more advances, such as a vaccine for TB, that may be a dream to end with TB. And I would like to highlight the importance of the multi-sectorial commitment. From the healthcare system, we won't be able to do it alone. We need relief for poverty. We need this type of policies that affected people are facing. So that's why we need a joint work together with the social development, justice, finance, education ministries. Therefore, I urge to strengthen the commitment and to work together, all stakeholders, all sectors, including the communities, the civil society, the university, decision makers that have a very important role, and only we will eliminate TB working together in the region. From the PAHO, we will keep working hand in hand with all countries to move forward. And to close up, I would like to thank all speakers, Dr. Barbosa, Dr. Alonso, all healthcare authorities, Dr. Barreira, Dr. Peña. Thank you very much for being with us today, for sharing your experiences. And thank you very much all our colleagues in the regions who are working day after day and in an important, strong way to contribute to eliminate TB. These are the first line workers who have the power to change this situation. And thanks to them, we see the results that we are seeing today. Thank you very much again for the logistic team, to the translators, to the PAHO team here in the regional office and in the local offices who have been working behind the scenes, our communication team, and especially of the TB team here at the PAHO. We really expect that you enjoyed and that you like this event. We hope that we can keep this commitment and this messaging flowing throughout the year. And we hope that this event was useful to reinforce, to strengthen our commitment moving into the future. Once again, thank you very much and have a great day.